Now, having discussed reversible and irreversible cell injury, we can now begin with our discussion of cell death. And as I told you, we'll be discussing the cell deaths in the same order that we discussed in the beginning. The first cell death with which we will begin our discussion is necrosis, something that you've already read in great detail in your undergraduation days, or if you're currently preparing for your professional exams. This particular question is important for your short notes. It is important for your PG entrance exam. It is important for image-based questions, and will also help you in your slide identification in the pathology practical. So whichever category of student you belong to, this particular topic is very important for you. So beginning with a discussion of necrosis. Number one, you need to know the definition. So remember, this is a type of a cell death, which you already know. But what I'm adding to your knowledge is that this is associated with inflammation. And this particular point, students, is extremely important, because later on when we discuss apoptosis, you will see that does not have inflammation. So the examiner tends to ask you which form of cell death has inflammation. So you remember, necrosis has inflammation. Now, whenever you're dealing with anything in pathology, what you can never escape is the microscopic examination. You have to understand how it appears under the slide, under the microscope on a slide. Remember, necrosis appears pink, it appears amorphous, and will show presence of inflammation. Now let's understand few things over here. First of all, you already know it shows inflammation, that is in the definition. You also understand that it is amorphous. See, morphous means something to do with morphology, something that has a shape, something that has a size, morphology. And amorphous means it is dead, so it does not have any shape, it does not have any size, it does not have any morphology, because it is a dead cell. Amorphous, simple to understand. Pink, why I want to focus on is, first of all, whenever I use the term pink, I am now going to call it eosinophilic. So before I proceed on with necrosis, there is one collateral knowledge that I want to share with you. In pathology, I am always going to deal with two stains. One is hematoxylin, and the other stain is going to be eosin. Remember, it is hematoxylin that is going to give the blue color, and it is eosin that is always going to give the pink color. So remember, whenever you say that pathology is pink and blue, rather than that, now you can say pathology is H and E. That is how you will see it written. It is H and E. That is, it is hematoxylin and eosin. So hematoxylin is the stain that gives the blue color, and eosin is the stain that gives the pink color. So this particular concept will help us throughout the subject. Now with this collateral knowledge, let's return back to what we were doing, that is necrosis. Now necrosis is something that is going to be pink. So now you can safely say that necrosis is the one that is going to be eosinophilic. It will take up the pink stain, that is eosin. Now, having discussed the basic, we can now go on to the favorite question with all examiners, that is types of necrosis. And the first type of necrosis that we will discuss is also the type which is the most common type, and that is coagulative necrosis. So we are discussing this as the first one because this also solves our question number 1. This is the most common type of necrosis. That is the first question that the examiner puts up. The second question that the examiner puts up in this is that why is this happening? So remember, the mechanism is that this is due to the denaturation of proteins. This exact line has been asked in the previous year Central Institute exams, that this occurs due to denaturation of proteins. Now coming to the practical application. The next thing that the examiner will ask you, what are the organs that are affected? So remember, the trick for this is that you need to remember the names of the solid organs. And which are the solid organs? So we can say, for example, we have the heart, we have the liver, and we have the kidney. So these are the solid organs, and coagulative necrosis tends to affect these organs. Out of these also, you can be asked that out of the heart, liver and kidney, if these are given as 3 separate options and you have to select one, then remember that the heart is going to be most commonly involved. So the most common involvement is going to be of the heart. In general, all solid organs, but most important, heart. So if you get a question saying that a 40-year-old male died of a heart attack or a myocardial infarction or angina, so you should know that the autopsy is going to show me which type of necrosis. So as soon as you come across heart and a solid organ, the necrosis automatically becomes coagulative necrosis. So that is an indirect way by which a clinical question will be put up to you. After you've done this particular concept, what you can never escape in pathology is the microscopic examination. How will this appear under the microscope? And there are 2 terms that are very commonly used. Number 1 are the ghost cells. What do you mean by these? That is, the cellular outline will be maintained, right? The cell outline is going to be maintained. But whatever is inside the cell, whatever is over here is going to be lost. The details are going to be lost. So you just see something in the outline and you see nothing inside, and that appears like a ghost, and that is why it is referred to as a ghost cell. There is also another term used for it, that is the tombstone appearance. It also gives a tombstone appearance. That is important. Now, at the outset, I want to tell you that whatever these questions we just discussed about coagulative necrosis, these are more of theoretical questions. But now the examiners have started liking image-based questions. So the image-based question I want to tell you for coagulative necrosis is this. So what I'll tell you is that I'm telling you that this is a section taken from the kidney. Do you clearly appreciate that there is one yellowish area over here which is distinct from the rest of the brownish areas? This is the area of necrosis. And again, I want you to correlate. If I'm telling you it's the kidney, I want to tell you it is a solid organ, right? And if I'm telling you it is a solid organ, this means the examiner is hinting towards coagulative necrosis. Next, let's focus on the microscopic image. So if you see over here, I want to divide this image into 2 parts. Why am I doing that? Because over here I can see a proper glomerulus. I can see proper tubules. All of them are going to have these blue dots inside them. Those are the nuclei. On the other hand, when I focus on this side of the image, I just see some ghost-like structures. Okay, there are some round structures present, but do you see any blue dots or nuclei inside them? No. So these are those ghost appearing cells. So this becomes the normal area, and this then becomes the area which is showing coagulative necrosis. So that is why I've got this image, so that you can see the normal and the abnormal. Even if you can't understand at this stage that this is a kidney, it's okay, because we will understand kidney when we go to kidney or renal pathology. But at the outset, what you should be able to differentiate right now, that one part of the image is showing the nuclei and all the details of the cell, and the other part of the image is just showing these pinkish, amorphous, ghost-like structures, and this is a slide of coagulative necrosis. Now coming back, students, this was the first and the most common type. What is the second type of necrosis? That is liquefactive necrosis. That is liquefactive necrosis. Right? Now, if you just focus on the term liquefactive, means there is something going to be liquefied. There is something going to be liquefied over here. And we'll discuss this shortly. First of all, remember, this is seen in the brain. It is seen in the pancreas. And it is seen in abscesses. So now the simplest example that you must have experienced yourself, or definitely must have witnessed, is an abscess. What does an abscess contain? It contains pus, right? Pus is something which is liquefied. So that is exactly what we're talking about over here. We are talking about liquefactive necrosis. Now remember, there is another term that is being used nowadays for this. Liquefactive necrosis is also known as colliquative necrosis. It is also known as colliquative necrosis. So liquefactive gives you more of a hint. So the examiner will give you a tougher term, that is colliquative necrosis. So now you understand that brain, pancreas, abscess, these are those areas where there is going to be increased activity of hydrolytic enzymes. Increased activity of hydrolytic enzymes. Right? So there is increased activity of the hydrolytic enzymes, and it is because of these hydrolytic enzymes that the liquefaction will occur, right? The material will become liquefied. So brain, pancreas, abscess, all of them have increased activity of the enzymes, and that is the image also that you need to know. Again, the trend of image-based question. Now students, whenever you encounter an image-based question, your first approach should not be to jump to a diagnosis, but there is a particular protocol by which you should follow to diagnose an image. Try to first focus on, can you see the parent organ over here? Very clearly visible, the sulca and the gyri. This is a section taken from the brain. Now students, if the examiner has asked you, okay, identify the type of necrosis seen in this image. Even if you don't know what this image is showing and you know that, okay, you can identify this much, this is the brain. An examiner has asked you necrosis, then you would know that necrosis in brain has to be liquefactive or colliquative. So half your battle is definitely won if you've understood the normal parent organ. But in this image, it is glaring and very obvious that there is this one area over here, which is that liquefied area, showing us liquefactive necrosis. It is showing us liquefactive necrosis. Right? So this is the image-based question that you need to know. Before we proceed on to the other types, what I want to tell you is that there is a difference. We just did coagulative necrosis and we just did liquefactive necrosis. Remember, in coagulative necrosis, the tissue architecture was preserved. The tissue architecture is preserved. Whereas in liquefactive necrosis, the tissue architecture is lost because everything becomes liquefied because the enzymes go and dissolve everything. So the tissue architecture is lost. So these are the first two types of necrosis that we have. The most common one, that is coagulative, and the second that we have is liquefactive or colliquative.